Okay. So, hello there and welcome to AI Arthritis Voices 360. We are live at the Auto Ball. Well, sort of. The Auto Ball. Yeah, my background is actually the National Museum of Transportation, the Auto Center that we were originally going to host the Auto Ball at. But unfortunately, due to COVID-19, we have taken these activities online. So we know it's a little bit ironic that we were planning on going out in the public, but here we are. And I'm not alone. If you're watching as we're streaming live here, I have a friend with me. I have Kaleb Michaud. Hi, Kaleb.
Hey, Tiffany, great to see you.
You too. Hey, Kaleb, why don't you tell everybody a little bit about yourself?
Well, my name is Kaleb Michaud. I'm an associate professor here at the University of Nebraska Medical Center in Omaha, Nebraska, and I'm the co-director of Forward, which is known as the National Databank for Rheumatic Diseases. And I'm here at the Worldwide Technology Raceway when no one's there. We're doing a major social distancing, but there's a bit of a crowd in front. I'm trying to get the best
Yes.
background.
Yes. And actually for the Autoball, the raceway, the Worldwide Technology Raceway we were going to do a couple events there while we have our event honorary chair, Angela Durazo, who will be live with us on Wednesday on actually World AI Arthritis Day, Autoimmune and
Very
Autoinflammatory
nice.
Arthritis Day. Yeah, she'll be joining us live. It'll be 1 p.m. I think 2 p.m. Well, I don't quote. Gonna have to register for an agenda to get the actual time, so you don't miss her. But yes, so uh, Forward Databank, they were going to be part of the Auto Ball also. So we had invited them to come to St. Louis and have a table because we work together so often.
That's right.
And it just this ball is really it is to honor all of the 450 million people around the world affected by our diseases, and also introduce what we do as an organization to a broader group of people and thank the people that we work with, like Forward and Kaleb and Rebecca and the whole team at your organization. And we wanted to feature a little bit about how we work together. So in this episode. So I want to point out that I am a person living with non-radiographic axial spondyloarthritis. Changed from rheumatoid arthritis in 2013 and a few other things. And Kaleb, you also are a person living with these diseases.
Yeah, when I was 3, they didn't know what was wrong when I was having trouble walking, and I was diagnosed with, at that time, juvenile rheumatoid arthritis back in the day. And as I've aged a little bit since then, and now I have a 2 and 4 year old of my own, um, it's now sort of juvenile idiopathic arthritis. The names and criteria keep changing, but the treatment for the most part stays the same. And that's one of the reasons why I've been doing this research for 20 years now, because it feels like a great way for me to give back to all of those people who helped me out when I was a kid, all the healthcare providers and those folks who try to make a difference to help me out. And it's my way of trying to do the same for others who might be in similar situations.
That's really interesting because I was talking in an episode yesterday that we were streaming, and the same thing for me. I didn't necessarily always think I'm going to be the CEO of a organization for these diseases. That when I was little, I wanted to be a veterinarian, and there
Right.
were other things that I thought
Astronaut and
were
dinosaur
there.
scientist. Yeah.
Oh, dinosaur
Yeah.
scientist. Well, now
Didn't know what a
that one's
paleontologist was then. Just said dinosaur.
At one point, I wanted to be a nun too, but that somehow
It's the
it just
same,
didn't
right?
pan
Wait,
out.
wait.
It didn't pan out for me. Uh, but it is interesting how where by these conditions I do become part of our new role, our new identity in life, and then taking it to a career level as well. I think it's just completely rewarding, and so I understand what you're saying, and that really is a is a great segue into the project that we're going to talk about today. And before, excuse me, before we get to, I just want to tell people who are listening that this show, AI Arthritis Voices 360, the official talk show for International Foundation for Autoimmune and Autoinflammatory Arthritis. And we are short is AI arthritis. Did you know that, Kaleb, that we're changing from IFAA to AI arthritis? Just like you had
I
an intern?
learned it recently, and I'm like,
It's only been
it's
like
all
2 weeks.
good.
So,
It's only good. It's all good.
so you must have been hot off the press then. Um, but yeah, so we, it's just more telling of what we do. So that just seemed to make a little bit more sense. But the other thing about this show and this talk show is it is always led by people living with these diseases. So we have a variety of co-hosts. So I have been kind of the main co-host, if you will, since we started in November. But that's mainly because we had to start the show. We had to get our procedures together. And Kaleb has been on one of the shows before, and we will link to that. It tells you all about what they do at the Databank and all of the other co-hosts that we have around the world. So we've got people from Europe and Mumbai and Australia, because as people living with these diseases, it's very important that we all have perspectives and experiences heard. We like to give back and do what we can, but we are just one person when it comes down to it. And I think that it makes it what this project is, which is called AI Arthritis Voices. So it is the kind of the sister project to this podcast. It makes it really apropos, because it's a way that all of you listening can also give back. You can also participate. You can also have your voice make meaningful impact in education, advocacy, and research. So
I gotta
this
say,
project, yes,
that's
go
been
ahead.
one of the most rewarding parts, honestly, is changing fields from doing physics research to doing arthritis research was a huge step. And but it made it easier to get up in the morning to know that I'm making a difference. But to meet other people who've been through similar situations, and the talented number of people who are making differences all around the world, is just brings such a joy to me and sense of gratitude when folks are doing well enough that we can actually do that to give back.
Dad just sent me a text message as he's watching this live and said, "A nun." Because if you just tuned in, I said we were talking about things I wanted to be when you're a little kid. Yeah, I wanted it for a while there. I wanted to be a nun. But
I
so I
wanted to
guess
be a
I guess my
minister at one
dad was
point. Yep,
shocked.
that's awesome. Hi, Dad. That's
So
awesome.
anyway, hi Dad. But anyway, so yeah, it is. It just definitely doing this as life work is I can't say that I would choose any other path at this point. It's just this has been an amazing journey, and a journey that has we have crossed paths on and started collaborating. I think we became
4 or 5
friends as
years
far as
ago.
organization. Yeah, I think probably met at conferences. I think at like ACR, the American College of Rheumatology,
Yeah.
visiting booths is kind of we met Rebecca, and what is Rebecca's official title at
Rebecca Schumacher. She's the executive director for Forward.
Okay. So that's where we had originally met and started to interact. And we realized that Forward was very forward thinking. You like that? And also extremely patient centered in everything you do. And I do want you to just talk a little bit about that, if you could, Kaleb, for people who aren't familiar with why we think that your data bank is unique.
So Forward was originally called the NDB, the National Databank for Rheumatic Diseases. It was founded by a private rheumatologist, Dr. Fred Wolf, in 1998 in Wichita, Kansas. And the goal was to basically get as many people with rheumatic diseases from around the country involved to answer questionnaires twice a year, so we could see what was actually happening to people in real life. Up to that point, for the most part, if you were seeing a rheumatologist and data was being collected in the clinic, all the doctors thought that they were doing amazing, because if you look over time, their patients were doing really well. But there really wasn't anything being gathered for people who left, who went to go see somebody else, people who weren't satisfied. And he was basically trying to figure out how well people really were doing in the real world and following the patients as opposed to the doctors, which a lot of our current studies still do. So that's been going on for 22 years. And we have very long, in depth questionnaires twice a year, January and July. You can do it over paper, over the phone, interviews, and online. And from that, from what the patients provide to us, we have published 400 papers now and continue to answer what the patients and the researchers feel are the most pressing questions now. And I will say that the most pressing questions now have been around COVID-19. And so we've been asking lots of questions recently about COVID-19 and already had a publication in the second week of April about what's happening to patients in the month of March. So that's how sort of rapid turnaround we've been. And we were already seeing signs within 2 weeks of people not getting access to their hydroxychloroquine and having problems getting access to care, which is huge because it's kind of funny. You think of a pandemic, an infectious disease pandemic, and you don't think of rheumatology as so important to that. But if you listen to the news, you paid attention, almost all of the drugs, with some exceptions with the antivirals being used to treat this, have been rheumatic disease drugs,
Yep.
DMARDs, disease modifying anti-rheumatic disease drugs. And it's just amazing and how important what we're studying and the patient's experience are to like as part of this pandemic.
Absolutely. I 100% agree with you on that. And we're actually going to have, as a side note, we'll be back here, not Caleb, but me and and Danielle, who is a volunteer with our organization, and she used to teach pandemics. And so she's going to give us a little bit of an overview of another podcast we did with her on the whole uh the whole concept of the pandemics, and then we're going to talk a little bit more, so make sure that you tune back in if you're listening on that. And we're going to circle back to at the end, Caleb, and ask people how they can get more involved with that, because I think that's really
Great.
important work. And so this we started developing this relationship. And one of the things our organization, so for those of you who are tuning in to learn a little bit more about what we do as a nonprofit, we just had our ninth birthday. So on May 7th, we turned 9, and it was actually on my birthday. I share a birthday with, because I did get the notification we were a nonprofit on my
Oh,
birthday. So it
funny.
was just, I
Happy
know, I
birthday.
just thought
Happy birthday,
it
Tiffany.
was like, wow. so so that was, so we just had our ninth. And one of the things that we have had to do, like any organization or any business or anything that's starting out and evolving, you must grow from foundation up. And it was a few years ago when we realized, okay, well, our mission, just get to reiterate to those listening, our mission is literally to help others like ourselves who are living with these diseases to have a voice alongside other stakeholders as equals, so that we can have conversations to solve problems that impact education, advocacy, and research. And to do that, we've been very successful on hosting the conversations, getting stakeholders together, going to conferences, making sure that the patient voice is an equal in those conversations. But we have to measure that data that we're collecting. And that's where Databank started to come in. So we said we need to build a couple different programs. So the first one in 2015, we won an innovation and research award, our organization, AI Arthritis, for a project called A Community Team, or ACT for short. And the concept of this was to get patient voices more involved in early drug development, so that we could expedite processes and lower the cost of these very expensive trials, but also so that patients could speak directly to a pharmaceutical researcher, and sort of have this triangle where we're pharma, we're researchers, we're patients, and we're all in this circle together. So to do that, we created an online hub. This was a pilot project, which means we were testing a lot of things. And in that, we had trained patients to be focus group moderators. I was the first one to go through, and I actually took a job at a qualitative research center when I lived in Phoenix briefly. And you'll be meeting Stephanie, who is now one of our employees, who was my boss at the research center. So
Circle of
how that
life.
all circles
Very
around.
nice.
Yes. So I took a job there so I could learn behind the scenes how focus groups are run and how we, if we did them online and utilize patients, could save money. So that's where the whole process of saving money came in. But we also realized that we needed to do this so that we could reach patients regardless of hope it doesn't happen again.
Good night.
We're
Hey.
back. So another thing that happens when you don't have a live event is your internet can go out. So we're back. But as I was just explaining, we had this ACT project, and from that we realized that now we need to create a permanent structure, a permanent online community, so that we can continue these conversations with people living with the diseases, not just for this ACT project, but for really all of the projects that we're bringing patients to the table, so that we can facilitate conversations, so that they can learn from us at conferences, and so that they can connect with other opportunities to have a voice. but we need to measure that data. And so we went to Forward, National Databank, and we said, would you like to partner with us? And that's kind of how this
Right. Right.
started, right? Um, and then we went and visited you all this summer, and we decided we were going to take it kind of to the next level and
Continue our relationship to the next level. So we're gonna go
continue our
arm in arm.
relationship and,
Yeah.
and build that. So this is, and we will share, we will be launching this week, as far as, again, like a pilot project, meaning if you are a person living with these diseases, or a parent of someone, you can apply to join. There is a screening process. It's not long, just 5 or 10 minutes to fill it out. But we do want to make sure that the people entering this site are people living with these diseases. So the applications are screened by fellow patients. And then once inside the site, you will have access to conversations and learning opportunities. So if we are doing something at a conference, for example, and we've learned something, then we are disseminating it back to you. We also have a section called Connect. And so like Forward is one that's in there. Other groups that we work with, like American Autoimmune Related Diseases Association, or ARDA, the Foundation for Sarcoidosis Research, anyone that we have done work with in any of our projects is in that site, because we always work with others. So if we're doing a conversation and we need Kaleb to zap him in there, we need to have them in there. But as a thank you for working, we also ask them to post their opportunities for you to have a voice. And so you can see what they're doing, and it gives you an opportunity when you're waiting for some of our projects to see what they're doing. So it's one big happy community.
Fantastic.
And yes, so we're really excited, and I'll tell you more about how to sign up. But where Forward really comes in on this is there's 2 levels to this community. So when you join, you are asked to set up an alias. So I won't even know who you are when you come in. So we could be really
Your
good
alias,
friends. And
Kaleb Michaud, and no one would know.
So we asked that for a few reasons. What we learned in our pilot study is, first of all, there are unfortunately, a lot of people online, like Facebook or social media, who either set up, and it's true, fake support groups, and they are actually people recruiting for research or trials, and they find those people through these support groups that they advertise. That makes patients leery to speak online sometimes, to share their stories, and with rightfully so. The second reason that we want people to have an alias and a private spot is because a lot of people don't want their name associated, don't want to talk about what they have or their association with the disease with their name attached, because their employer could be looking, or something where they feel a little nervous about being completely honest about some of their struggles. Another reason is, frankly, not all of us like each other. That's just the truth. And so if you're in a site and you say, well, I don't want to be part of this conversation because I'm not really friends, don't really like what this person has to say, so we'll get more people involved and more perspectives. And then fourth, if you're in an online group, or you may be friends with others and you don't want to be judged by your opinion. So you're free to say what you really feel. So there are aliases. And then what happens is, if you move to one of our projects, like our ACT project, or other ones that we're doing, the Preparing for Precision Medicine, any of the projects that as an organization we need to research, we need to measure your responses, we will ask you to sign up for the data bank. And they have been so gracious to let us house our data inside the National Databank. And that's going to be really exciting, because we'll be able to work together to improve the projects. Did you want to add anything to that, Kaleb? I've been talking a lot.
We've been doing this for 22 years, and having a HIPAA compliant anonymous data bank it's incredibly important to make sure that what we are collecting from patients is private, safe, and secure. And when we work with researchers, it's always anonymous. There's no way to figure out who people are. And it's actually one of the nice things about the research we do is that we found that patients feel more comfortable telling us what they're actually taking and doing for their treatment personally when they're not talking to their doctor. When they're not saying, well, this is what I actually did. I didn't actually take that drug you wanted me to try because I just didn't want to deal with the side effect, or I wanted to be able to drink an alcohol or something like that. So, I've always felt like we've
Hmm.
spent so long building this infrastructure in place that there's no reason we shouldn't be able to use it for other projects like this. So, I mean, I think it's fantastic, and it's fantastic pairing.
It is a fantastic pairing, and so we are going to be planning some other dual projects now that we have this collaboration going. One of them is for undifferentiated disease. If you've tuned into any of the live shows that we've done over the weekend, you'll know that AI arthritis, we focus very strongly on early disease progression, symptoms detection. And one thing that we talked about, Kaleb, when we met was there really isn't anybody logging these symptoms in real time, because most research is recall. You're going back and thinking, right? That's the typical way that people
Right.
report.
Like, what did you first experience it? When did you do it? What happened to you then? And where are you at now? And then it takes some time to sort of figure out actually what happens to people and what they actually have.
Yes. And there's always a bias with recall because you really can't remember 100% what happened day to day when you're talking, years before. So we are going to be setting something up where we can start to monitor people who have not yet received a diagnosis and be the first, we believe, to be tracking this rheumatology journey in real time. That's kind of exciting,
Yeah,
I
very
think.
much. I mean, it's a truly unmet need. Like, there's so many folks who either don't
Yes,
think to see a
absolutely.
rheumatologist or a certain doctor, or they don't, the doctors they see don't have an answer, don't know where to go next. Um, and you get in this limbo case where something's not right, but you don't know what's wrong. And it's not a fun place to be, and
Right.
especially when it can last for years. And there's a lot of hopefully unnecessary misery that we can help prevent by getting it addressed earlier than later.
Absolutely. And then we for those of you who have been living with the diseases for a while, we also through our ACT project and other work, including this undifferentiated project, we can still build on that and start to understand, which I know Forward does anyway, how treatments are responding to people and working more on understanding those subgroups of patients who respond maybe better from one treatment to another, which then goes back to AI Arthritis Project of preparing patients for precision medicine. And you see how that all ties together. So, so that's some of the stuff that we'll be working on. Uh, Anything else you want to add to that, Kaleb?
I, you know, that's the one nice thing about working on this research area is that when Dr. Wolf set out in 1998 to do this, we asked lots of important questions that patients thought were important, but there's a lot of things that we didn't know the answers to, and that's why the questionnaires are a bit long in Forward. Honestly, is that we want to collect all the things that aren't being collected in the clinic and do it
Mm-hmm.
comprehensively in a way. And right now, we've been, last few years, a lot of patients who are participating say, hey, what about this? What about this? And we look into those things, and like oftentimes there isn't much out there. And it's sort of finding more and more unmet needs that we can address with what the patients and participants are providing with us. And the more researchers who have some of these conditions, and even people who are just sort of knowledgeable enough to say, hey, what about this? I've looked into this. What can you do here? The better we all are for it.
Absolutely. And that is one of the reasons why we are encouraging all people living with these diseases, including those not yet diagnosed who are suspect or undifferentiated. You can find this new site at aiarthritis.org. I mean, excuse me, aiarthritisvoices.org. And we will be We will be accepting applications for that starting this week. And the conversations that we have inside there will help us and help Forward to start to identify some of those gaps and other things that we should be researching. So it's really important to get all patients involved in that. Also, Kaleb, where can people find you? Well, Forward. They can find you too. You could do both.
So our website, that you can do ndb.org, but it's mainly forwarddatabank.org. So we are a 501c3 nonprofit research organization, and it's sort of celebrate that fact that we are doing this not to make money, but to really make a major contribution to the scientific community through the help and support of patients. So forwarddatabank.org.
That's really an important point, I think. I'm glad that you brought that up about being a nonprofit as well. Also, this is a part of the Auto Ball, so we are hoping that you will share these live broadcasts. That you can go back and watch them after the fact. We do hope that you will share what we're doing as an organization, what Forward is doing as well with other people, because one part of the Auto Ball was to make sure that people start to understand what we do. So, because only if people know that we're all around can we help more people. And then I also wanted to just, in closing, say too that I mentioned in the beginning, this AiArthritis Voices is the sister site to this podcast. So this podcast called AiArthritis Voices 360, the idea is that we can take the information that we're collecting in the site, bring it back onto these shows, talk about some of the topics, develop them into programs, and controversially, then you take what we're talking about here, if we're introducing a topic, and we'll bring it back to the online community, and it will kind of crossbreed itself. So there is a method to our madness that we
That's
have.
good.
So
It's good to
both of
get
these are
feedback
two.
and grow and improve over time. So that's great.
Exactly. So I want to thank everybody for tuning in. You can find all of our podcast episodes, including the one we did with Kaleb. We did that at the ACR, the American College of
That was a lot of
Rheumatology,
fun. A whole different world of
last year. Yeah, so that one is on our site too, and it talks to a lot more about the data bank. So please make sure you find that. You can find that in all of them at aiarthritis.org/podcast. And then we also would welcome if you could lend any support to the organization. You could always download the registration for this and donate at aiarthritis.org/autoball. So if you register, you'll get all of the links to all of these that we've done, and we'll give you more information about our projects, including the AiArthritis Voices that we're doing with Kaleb and the crew over at Forward. So thank you, Kaleb, for joining me again for our second.
Tiffany. I'm
Our
glad you're
second.
healthy
I
and
love.
well, and do be well. It's funny because that podcast we did last fall at ACR was such a fun time, and it's before we even knew what COVID-19 of those words might be. So it's definitely how fast the world can change and why it's so important to be working together on this.
Yeah, absolutely. Before we close, let me just circle back with that. So I'm glad that you brought that up. How can people get involved specifically if they want to get involved with the COVID work that you're doing?
So we've had our 5th 2-week questionnaire goes out this week, and it's been done with a little bit in parallel work with the International Alliance on this. But on forwarddatabank.org, we have a pop-up screen about COVID-19. And so whenever you enroll or consent to be in our study, you can then choose to answer that. It's much shorter, very brief questionnaire about your experience with COVID-19. And then we're wrapping that up in the next 2 weeks, and then we'll just be reverting back to our July 6-month questionnaire, where a lot of those questions will be incorporated into that, because we didn't know to ask that in January. It just wasn't on the horizon at all. So
Right.
that's the best way. And a lot of the questions we ask are being asked by the CDC and other places as we're trying to learn what's working and what isn't at this point.
Okay. Okay, and our organization is supporting that work as well, and you'll learn more about what we are doing as an organization if you tune back in today at 5 p.m. Eastern Time, where we talk specifically about COVID-19 and AI arthritis work that we are doing
I'm
here. So
looking forward to
again,
listening.
now circling back, thank you again, Kaleb. So didn't want to forget that; that was very important. And for all of you listening, please make sure that you always check in on our shows and the link we have on Facebook. We have a new group called AiArthritis Voices 360 at the table. It's linked to our Facebook page, and we have all of the podcast shows that we've done thus far also in there, and you can always just ask questions, and we'll see that there's something comment has come in, and we'll join you and join the conversation, because only together can we solve the problems of tomorrow. We always want you to also pull up a seat. So thank you, Kaleb, and thank you everyone for tuning in. And
Thank
sorry
you.
we had an interruption.
Real
Bye.
life.